Hello, my name is Teressa and I'm a fourth-year student in the Faculty of Nursing. Today I will be presenting on my current research, which is a scoping review on the perspectives of acute care healthcare professionals on harm reduction strategies. For background, did you know that 21.6% of Canadians met the requirement for substance use disorder during their lifetime in 2015? This finding has significant health implications. For example, people with substance use disorder are disproportionately affected by comorbidity and premature mortality. Common comorbidities of substance use disorder include mental illness, chronic pain, infectious disease transmission, cancer, and heart disease. Further, this population has low access to primary care services, which increases their burden of disease. As a result, those with substance use disorder utilize significant amounts of acute care services to address their unmet health needs. Despite an increased need for medical care, patients with substance use disorder are 3 times more likely to be discharged from the hospital against medical advice when compared to patients without substance use disorder. Current research findings identify suboptimal management of withdrawal symptoms, untreated pain, and strained relationships with hospital staff as significant reasons patients with substance use disorder leave against medical advice. Harm reduction strategies may be a way to address this health disparity and promote better outcomes for patients with substance use disorder. Harm reduction refers to the policies, programs, and procedures that try to prevent harms related to substance use without promoting reduced consumption or abstinence. Healthcare professionals may find integrating these strategies into their practice challenging because harm reduction requires an ideological shift from fixing a patient's substance use disorder to reducing the harms associated with it, and this can challenge the values of some providers. Understanding the perspectives of healthcare professionals on harm reduction in acute care settings can help implement harm reduction strategies in these settings. So my research question is, what are the perspectives of healthcare professionals in acute care settings on harm reduction? In this context, acute care is defined as the clinical settings that provide time-sensitive interventions to prevent injury, disability, or death. An example of this is the emergency department. Healthcare professional refers to the regulated professionals like nurses and physicians and excludes unregulated workers like healthcare aides and students. For methods, a scoping review protocol was developed using the Joanna Briggs Institute's guidelines. From here, a preliminary search in Google Scholar identified relevant articles. Keywords from these articles, titles, abstracts, and indexing terms were assessed and used to create a list of relevant terms to then search in databases. This is the developed search strategy, which includes all identified keywords and indexing terms. To optimize each search, terms were adapted for each unique database. The databases that were searched are Medline R, CinePlus with full text, APA PsycInfo, and Embase. In total, 2,473 unique articles were identified across these 4 databases. After the search is complete, screening the articles is the next step. Screening happens in 2 phases. In the first phase, the titles and abstracts from all identified articles are reviewed, and relevant articles are selected to move on to phase 2. In phase 2, the full article is read to ensure it meets the study's criteria. At each phase, 2 independent reviewers will assess each article against the inclusion and exclusion criteria. Any disagreement amongst the reviewers will be resolved by an additional reviewer. Important to note that this current research is in the first phase of screening. After the screening process, data will be extracted from the remaining articles. On this slide, I've highlighted the elements that we're looking for data extraction and the tool that we'll be using to document this data. Results will be tabulated and presented in a narrative thematic summary. The summary will describe how the results relate back to the review's objective. Overall, the results will consolidate the current literature on the perspectives of healthcare professionals on harm reduction in acute care settings, which will identify areas for future research and inform key stakeholders. Thank you so much for watching this presentation on my current research. While I have been a key investigator on this project, I have not completed it alone, and I would like to acknowledge the contributions of Associate Professor Lyons and undergraduate student Marika Lee.